You can start whenever you're ready.
Good morning, good evening, good afternoon, wherever you are, and welcome to the ARRB Lens Seminar Series. We are so excited to be on today and discuss some of our work. My name is Priyanka Fernandez, and I'm a brown woman with black hair sitting at my office computer on campus. I'm a preventive medicine doctor at UCLA. I have with me Candice Granyani, a white woman with dark brown hair, sitting at her home office computer. She's a preventive medicine doctor at UCLA as well. She and I work together in the community-based lifestyle intervention node of AIRB. We are excited to be given this opportunity to talk to LEN trainees and other researchers about this important topic with relation to physical health and autistic individuals. Through this presentation today, we hope to cover three main learning objectives. We will first go over some high-level knowledge and research gaps around physical health and lifestyle interventions for autistic individuals. We will then move to a panel discussion to discuss objectives 2 and 3 outlined here. These objectives focus on helping researchers understand and to some degree even reimagine outcomes of interest when talking about lifestyle interventions. And then we are also curious and are wanting to talk about what we mean by community in this population. So diving in, as we recognize more autistic children and adolescents moving into and transitioning into adulthood, we are finding that autistic adults have a higher incidence of many chronic conditions. Some are outlined here. Most frequently, we see gastrointestinal problems, problems with nutritional quality, sleep problems, weight management issues, both ends of the spectrum, obesity as well as anorexia, physical inactivity, and poor social well-being. And when we are talking about disparities, these health disparities are only widened when we add other social determinants of health, including race, socioeconomic status, education, etc. We highlight here a particular study from some of our colleagues at Kaiser Permanente in Northern California. The study aimed at looking at the frequency of psychiatric and medical conditions among a large, diverse, insured population of adults with autism in United States. It was a case-controlled study with autistic adults enrolled over the time frame of 2008 to 2012, and it compared to, they were age and sex matched controls. Adults with autism had significantly increased rates of all major psychiatric disorders, including depression, anxiety, bipolar disorder, obsessive compulsive disorder, schizophrenia, and suicide attempts. Nearly all medical conditions were significantly more common in adults with autism, including immune conditions, gastrointestinal and sleep disorders, seizure, obesity, dyslipidemia, hypertension, and diabetes. That's seen on the next slide here, the physical health conditions. What do we mean by lifestyle medicine then? Lifestyle medicine tries to address lifestyle choices that increase the risk of chronic diseases, which are more often than not preventable. It has been shown that optimizing our health behaviors in these 6 pillars outlined here in this slide can help reduce chronic diseases by up to 90%. The 6 pillars include having a whole food plant-based nutrition, physical activity, stress management, avoidance of risky substances, restorative sleep, and social connectedness. Evidence shows that optimizing lifestyle practices can not only prevent, but oftentimes even reverse these disease conditions. The community-based lifestyle interventions node is interested in building the evidence around using spaces and support systems beyond the clinical setting to improve lifestyle behaviors of autistic individuals. So in doing so, it will be important to more purposefully include autistic individuals to better understand what social connectedness looks like in this population. And it may be different for different autistic individuals. So you could potentially see an autistic individual not just increasing their social relatedness in terms of numbers, but the quality of their relation, even if it's a few close friends or family members, or few relationships that they may have. It will also be important then to include autistic individuals to better understand what community means to them and what can public spaces do to be more inclusive of their needs. Talking a little bit about the gaps in the literature in this particular field. In scanning the literature, there are some clear needs that emerge, some of which are outlined on this slide here. Oftentimes, there is a one-size-fits-all approach, which tends to be exclusionary. And when thinking about health more holistically, using the 6 pillars of lifestyle medicine, we often need to use an expanded scope of focus rather than be narrow and linear. This could pose some methodological issues for researchers, not only in terms of study design, but also developing measures of success. Similarly, developing and maintaining a healthy lifestyle can take years, and oftentimes funding does not allow a study population to be followed in that longitudinal fashion. Very few studies have explored community spaces beyond the clinical and school setting. And lastly, most importantly though, as discussed in the previous section, it is important to include autistic individuals in the development of community-based lifestyle interventions and research studies. So then, recognizing these research gaps, the community-based lifestyle interventions node of the ARRB aims to support, develop, and evaluate interventions that better incorporate the 6 pillars of lifestyle wellness, improve social connectedness as determined by and for autistic individuals, promote self-determination and self-advocacy, and engage autistic individuals, families, and communities. With that brief overview, we will move on to the panel discussion on the topic. In doing so, I will hand off the mic to Dr. Constance Smith-Hicks, who is going to introduce herself, the panel, and facilitate the discussion.
Hello, and thank you, Dr. Fernandez. Thank you all for joining us for the panel discussion, where we'll be talking about community-based lifestyle interventions. I'm Constance Smith-Hicks, a neurologist and physician scientist at the Kennedy Krieger Institute and Johns Hopkins University School of Medicine. I'm a woman of color sitting at a computer in my office. I'm joined today by 3 panelists who I will invite to introduce themselves. We'll start with Dr. Brown.
Hi, thank you for having me today. My name is Dr. Heather Brown. I am a white woman sitting at my desk in Edmonton, Alberta, Canada. I am an associate professor in the Faculty of Education at the University of Alberta. I am also an autistic researcher who researches autism. I'm currently serving as the co-chair of the Autistic Researcher Review Board for the Autism Intervention Network on Physical Health. Thanks for having me today.
Dr. Seeley.
Hi, my name is Vanessa Seeley, and I am a white woman sitting at my kitchen table at my home in Fresno, California. I am a community pharmacist and work for Walgreens, but more importantly, I am the mother of 2 identical twin boys who are on the autism spectrum. And so I am here to offer my input on the lived experience of having this at home. Thank you for the opportunity.
Thank you. And Dr. Granani.
Hi, everybody, and thanks so much for having me today. My name's Candace Grignani. I am a white woman with brown hair sitting at my kitchen table here joining you today. I'm an adjunct assistant professor at UCLA in the Department of Medicine. I'm also a pediatrician and a preventive medicine physician. And I, alongside Dr. Priyanka Fernandez, am the community-based lifestyle intervention node leader for the Autism Intervention Research Network on physical health. I am also very lucky to be Dr. Seeley's sister and aunt to her wonderful twin autistic boys. And I'm looking forward so much to our discussion today. So thank you for having me.
Wonderful. It's great to have such diverse experiences, and I'm really looking forward to our conversations together. As you all know, autistic youths are known to face disparities in quality of life related lifestyle activities, and these activities that promote health and well-being. These disparities rather have really increased the burden of a variety of chronic health conditions, as Dr. Fernandez shared earlier. Given your diverse backgrounds, I'd like to hear from each of you on your thoughts regarding the following questions, and we'll probably start with Dr. Brown. So what are some of the lifestyle issues that you think should be prioritized by those working to develop community-based interventions for autistic youths? And what types of community spaces do you think are ideal places to engage autistic youth and their families in promoting these activities?
Thank you. Well, the appropriate targets for community-based lifestyle interventions have to be focused on what does it actually improve the overall well-being of a person with autism. Too often we assume that a person with autism needs to look and act exactly like everyone else in order to achieve well-being, and that's not necessarily the truth. Often many of my so-called atypical behaviors, such as stimming, could actually be helping to regulate my nervous system. And so when we're looking at any kind of intervention, we really need to sort of focus in on what does that child need to achieve well-being? In other words, what kinds of things or events or feelings or activities or pursuits or persons or whatever continue to make a positive contribution to our lives? In terms of what kinds of interventions, I can only speak from my own personal experience. So I'd like to just describe 3 sort of interventions that I found have been most effective as a person with autism and as a mother of a neurodivergent son. And so the 3 ideas, or the 3 big key things, the first one is mindfulness-based stress reduction. My nervous system is hypersensitive to the environment. I am constantly pushed into overstimulation by sounds, by noises, by tastes, by touch, by the stress in my environment. And for too long, nobody has really, I really wish that I could go back and be 5 years old again and have my mother teach me how to regulate down, how to meditate, how to be okay in my body, even when the outside world is not okay. And as hard as it has been for me to learn how to do that, it has made an incredible difference in my life. The other thing that's been a big help in my life was physical activity. And I know you're going to roll your eyes because, of course, physical activity, everybody says you need to exercise. But if you're hypersensitive to the environment like me, or if you're underreactive, if your nervous system has trouble activating, if you do physical exercise, your body suddenly gets back into the right place. I have to do a lot of stressful things. Talking right now in front of all of you is stressful. But what I've learned over the years is that if I exercise first before I do that stressful thing, if I try and use up all that energy in my system, I can sit down and do what I need to do. And so anything that you can do around mindful movement, around building strength, around actually getting your heart rate up and moving, all of those things will help you feel better in your body so that the rest of your life is easier to manage. And then the very last one is around individualized supports. Even with all of my education and training, I still don't totally understand how my nervous system reacts, how my body's reacting, why this or that variable is having such an impact. And so it has been incredibly helpful to either have mental health counselors or have physical therapists or have occupational therapists or have speech language pathologists, all of those people guiding me to make the outcomes that I want to achieve. And that's key. They have to be something that I want. They can't necessarily be something that you want just because you think it will help. I have to care. And I think that that's something that's hardest for people with autism. It's really hard for us to just do something because you tell us I should. We really have to believe in it. We have to see the benefits for ourselves, and it has to be an outcome that's important to us. So that would be my answer. Thank you very much.
That's wonderful and very comprehensive. Dr. Seeley, as a parent of autistic twins, what are some of your thoughts and experiences on these issues?
My kind of thoughts about what physical health priorities would be in my experience with my two kids. One, I think that would be particularly important would be sensory processing and integration, also exercise. And then the third, I think, would be nutrition. And I think some of these could very easily be kind of integrated, and you could combine multiples into one event, or, you know, a group type of event where you have strands of all of these present. But when you look at something like exercise and you take into account the sensory processing issues and integration, you've got to think, you know, some of these kids probably don't want shoes on their feet. One of my little boys, when he was 3 and 4, I couldn't drop him off at school sometimes because he wouldn't keep his shoes on. So you're going to, it's a little challenging to kind of predetermine what kinds of issues might arise in these kids. So maybe you need to have some indoor space where they can participate in activities where they don't have to wear shoes, that's a safe space for them. I think it's important when you're looking at these things to have also, and I don't know, maybe Dr. Brown could speak to this a little bit. I know my kids, sometimes they like it very loud, sometimes they like it very quiet. And so you might need areas where they're, you know, within these community events or things that you have a safe, quiet space for some of these kids where they can go take a 10-minute sensory break and nobody's talking to them, or they can wear headphones and they can kind of reset and regather and come back and join the event. And I think there's so much truth to what Dr. Brown was saying. A lot of times we kind of force these stereotypical ideas of what we think success is and try to mold them into these norms. And sometimes, you know, one of my kids participating in a community event with a lot of people for 15 minutes is a home run. And, you know, it's like, well, you did not qualify to enter the study because you didn't stay for the full 2 hours. Well, heck, I'm throwing a party and my kid didn't meet the exclusion criteria, right? So it's hard. It's going to be very challenging to figure out how we meld these things together. But yes, I think the outcomes definitely need to be looked at. And back to my thought about how the exercise must be flexible. I know some, you know, have problems with fine motor skills. So you're going to have a range of skill sets, even if you include kids of the same ages. And then also on the autism spectrum, some are going to probably be nonverbal. So if you have people trying to help them with sports that are just, you know, talking and shouting all of these commands at them, that might not be the best fit. You need to accommodate things for the verbal autistic individuals and also the nonverbal, like icons with someone kicking a ball or, you know, there's a lot of things. I think that get missed, and necessarily so. I can honestly say I never thought about any of these things before I had my kids, and I was forced into this environment and had to kind of decode what was going on. And so, yeah, those are kind of my thoughts. Just a little quick bit on nutrition. That in my house is very difficult. My kids personally have a lot of textural issues. I come from I'm a pharmacist. I know vitamins, I know nutrition, I know what they're supposed to be getting, but when you stick it in their mouth and they spit it at you and start crying, it creates such an issue because, I mean, they've got to swallow it, right? It comes down to that. So I think there's also maybe even, room in the community. I thought what would have been helpful to me as a parent. What if you had some kind of amazing, a food fair situation where these kids could go taste all these different foods, and they were not, there's so often we're so quick to judge, and you're wasting that, and you should chew that, and you should eat that, and what if they could try a bunch of fresh fruits and vegetables and they didn't have to eat all of them, and their parents finally knew what fruits and vegetables that they were willing to eat? It doesn't have to be overly complicated. It just has to be tailored to the needs of what these individuals need. And I think also there's, back to the nutrition issue, there's also impact of medications in the individuals that take medications that affect that too, as far as if they're hungry. Some of them are on stimulants, and it's even harder to get them to eat because they essentially are on something that's suppressing their appetite. And so you got to work even harder to find these things that they're willing to try. So those are my thoughts on that question.
That's wonderful. It's been really exciting to hear the creativity and the practical comments that you've made, some of which perhaps are not thought about by clinicians and researchers on the ground. So I'd like to hear what Dr. Granani has to say. I think that she can weigh in here as a clinician and researcher.
Yeah, thanks so much. And thanks to Heather and Vanessa for all of your thoughts and comments. Vanessa is always my go-to when I'm personally thinking through things, because I consider her the greatest expert personally that I know, and because the boys are so different. And I think, right, that thread kind of echoes throughout the conversation in terms of what Heather has really spoken to and what Vanessa has spoken to, both about their lived experience, either personally or as parents of neurodivergent children. And I think that is the hard part for researchers too, in general, right? We, as researchers, try to create some sort of formulaic type intervention. And really that doesn't lend itself to working with autistic individuals because there's such a variety of needs, of developmental stages, of variation, even within one day for the same individual. And so flexibility really is so key, I think, to a lot of these research designs. And I think the other important part too is when I think about community-based lifestyle interventions and what do we focus on, I think also to Heather and Vanessa's point, there's so much to focus on and there's like so little that's been done that really it's kind of like a wide open space. So the importance of working with the community that you're in terms of like what their priorities are, talking to parents, talking to autistic youth, seeing what their priorities are in terms of, is it really nutrition? Is it sleep? Is it physical activity? Where do we start, right? And to that end, having them weigh in on the kinds of things that they think would be helpful or the spaces in their community, if you're particularly not from that community, which happens a lot with researchers too, right? You may not be familiar with what community resources and assets are there. So like working with those parents and families to see where are the spaces they like to go. Can you plant your intervention there? Can you pilot it there? And then rethinking really what the outcomes are. And they have to be, I think, a lot less traditional than we usually do in terms of, yes, objective measurements can be helpful in terms of looking like, okay, well, you can use weight or blood pressure, right? Are those really significant, meaningful changes? I have a feeling that the self-efficacy or self-determination or, right, caregiver confidence in selecting, fresh fruits and vegetables that their children might be more willing to eat on a given day. And that might change every day, right? But creating those spaces for those kinds of outcomes, I think, is really a priority. And one thing that I was thinking when Vanessa mentioned in terms of, and I think Heather touched on this too, right? Like trying to create these interventions that really touch on kind of multiple threads. One intervention we've been toying around with the idea of, and I've actually talked to Vanessa about this a little bit before, is this idea of a teaching kitchen in terms of like working on motor skills. And again, you can kind of tailor that to the motor skills of each individual participant, particularly if you're able to pair it with something like an occupational therapy team that comes in, giving parents a respite from doing that work, but also hopefully skill building on the kids' side. So it's something they can do at home, and then creating like a shared space for the youth or youth with families. You could imagine all sorts of ways to do this, right? Where they can have a social centered meal, like share the meal with individuals. Maybe some people want to talk, maybe they don't. Maybe some people want to go sit by themselves, and that's okay too, right? But creating that shared food space, which actually in a lot of pediatric literature is actually quite important to overall nutritional status. That's one of the key questions you can ask, is how many times do you sit and eat as a family together, which can be really hard for families who have autistic individuals, right? In terms of the social setting and the hunger and all of that. So those are just a few of my thoughts.
Wonderful. I think Dr. Brown has some additional thoughts that I'd be really curious to hear.
Well,
Dr. Brown, here you are.
thank you. I just wanted to build on the food. Food is such an issue. Food has always been the bane of my existence. I was the kid who refused to eat anything, nothing. When I was an infant, I would only eat baby food, carrots. And when my parents tried to put me on solid food, I wouldn't eat any of it. And so I remember the screaming and the fights and the, would you put the peas in your mouth? What I will say is that is the wrong way to teach a kid to eat. The absolute wrong way. If you want me to eat, I have to be calm. Do you know why? Because I have to be calm in order to digest my food. And so if everything is a fight, if it's a fight about getting it to put in my mouth, if it's a fight, even if you're giving me a reward, all you're going to do is teach me that I really, really hate food. And so I will say at the age of 45, I have gone back to baby food. Every single day I eat a smoothie that I blend up. It's always made with the exact same fruits and vegetables. It has the protein supplement, and I do it every single day. Why am I telling you that? No, that's not the outcome I want for autistic children. Absolutely not. I'm telling you that because I'm alive. I am a fully functioning, healthy human being who eats the exact same thing every day. And because I eat the exact same thing every day, I'm never surprised by what I'm eating. I learned that by eating the exact same thing every day, I actually get more enjoyment from my food because I know exactly what to expect. It's prepared the exact same way. It's never prepared weird. It's never burnt. It's never nothing. It's just fine. And guess what? The food goes in. The other thing that I learned is I have to literally lie down in the dark in order to feel hungry. I have to regulate down. And so my schedule is to lie in the dark once I'm done my workday and literally listen to my book for 2 hours. And usually at the end of those 2 hours, if I don't fall asleep, I get hungry and I eat. So do you see, like my point is not that I think that all autistic children should do this and this is an ideal outcome. No, no, no. It's an ideal outcome for me. It's keeping me healthy. I'm experiencing well-being and everything's manageable. Do I wish it was different? Yes. The only way I think it could have been different is if we had removed the fighting. If we had done what Vanessa was saying and what Candace is saying about having food kitchens and having fun experiences and trying food and being willing to touch it and being willing to play with it. All of that enjoyment is going to make it much more likely that I'm going to try the food. So I hope I didn't take us on a huge tangent, but food has been such a big problem and issue in my life, and I just needed to share.
That was really excellent. You talked about food earlier. I heard talks about sensory and need for movement and regulating oneself. And you also spoke to the importance of bringing all of these items together because they don't exist in isolation of each other. And so with that said, I think Dr. Granani brought this up earlier, but I wanted us to focus a little bit on what are the ways to target these lifestyle interventions when we think about it from a research perspective? How do we measure these outcomes? And how do we decide if it's quote unquote better quality of life, and who makes that decision? Vanessa, perhaps you could start us off.
Sure, I would be happy to. I've thought about it, and I've talked also with my sister a lot about this. And I think the things that have made the most difference in our household are looking at quality of life, both for the autistic individuals, for my kids in general, and then also for the caregivers who primarily I do that, but I mean also my husband, other family members and such. And what I see is a lot, most, in fact, I would say, of the quality of life indicators I think about are very well aligned with each other when I think about how my kids react to things and what improves their quality of life. And then that spills over, in fact, into the caregivers and their quality of life. So kind of ideas I had, and some things, measures that we've looked at in our own house are things like stress reduction. And you can see that in, how many meltdowns are my kids having a day, and how long are the meltdowns? An hour meltdown is more stressful for them, and it's more stressful in everyone in the house compared to a 10-minute meltdown that they recover very well from and can get on with their day. The duration of these things and the frequency of these things. And I think, when you have a successful exercise regimen and these things, naturally, you don't have to work particularly hard. When they become habitual, these things naturally decrease. The meltdowns decrease, the frequency decreases, and the duration of them decreases. It is kind of a natural progression. I mean, at least in my house, you could look at their increased utilization of coping skills when they're frustrated in a situation. Do they start deep breathing, or do they ask to go jump on the trampoline, or, do they ask for a quiet space, or do they hit and kick and go into a full-blown meltdown? I think when they are happier, when they eat foods that they like, when they've had a chance to swim and exercise and run, what I see is they are more likely to say, I need space, I'll be out in 20 minutes, Mom. And that's okay. And that's so great. And I think other things too would be looking at improved sleep and improved GI health. I know a lot of autistic individuals also in our house struggle a lot with constipation, diarrhea, both, either or. And if I think GI health, though, also, all of these physiological mechanisms are so tied together. If you reduce the stress, some of your GI health improves just from the stress reduction. Of course, many other factors play into that. But yeah, a lot of these things are not mutually exclusive. But definitely for my house, the most valuable measures would be stress reduction, and then increased coping skills, I think.
Wonderful. How about you, Dr. Brown? And then maybe we'll go to Dr. Grignani.
I would agree with Vanessa. Those are excellent outcomes. And I would, so I think it's an unreasonable expectation that I will not melt down. That's unreasonable. When you have a nervous system like mine, it's going to happen. And the more stressed I get, the more likely it's going to happen. So that cannot be the outcome. But she's absolutely right. It's about how long did the meltdown last? How often is the meltdown happening, right? Weird outcome measures for me have actually been feeling really, really cold. So if I feel really, really cold, like really cold compared to everyone else, I know I've been chronically dysregulated. Now if my sleep patterns, like I'm really good at a pattern, I go to bed at the same time, I wake up at the same time, but then I can see the patterns of how I'm getting dysregulated and how suddenly I'm getting up really, really early or really, really late. Like there's all sorts of those sort of early warning signs. For my son, he's 18 years old, and it was a struggle every single day to get him to go to school. He hated it, hated it, hated it. Looking at him now as an 18-year-old, What I am most happy about is when he independently decides to do things that he wants to do, and then he accomplishes those goals. That is an amazing outcome to me. If he does an amazing job working on the farm, that's what he's been doing lately. He loves working on that farm. It gives him a lot of freedom, right? Like you get a list of things and then he just has to go do them. Regardless, he's surprised me in ways you never would have expected. If you saw his behavior at school, you would never think, oh my gosh, that kid can be highly responsible and highly conscientious and do a great job. Yeah, he can, because he wanted it, because he was now invested in it. He was engaged. It was meaningful to him. And so sometimes that's the outcome. It's that they want something and then we help them reach that goal.
I
That
love
is-
all these answers. Sorry, Connie, I interrupted you.
No, I was just reflecting on that
Yeah.
and thinking it's a really powerful statement, right? Because when we are, all of us, when we are invested in something, whatever it is, when we engage in activities that utilize our skills and our talents and our passions, that's when we excel. That's when we are at our best and have the best quality of life. And so I found that a very powerful statement. Go ahead, Candace.
Yeah, I also thought that was so profoundly powerful. And I imagine Vanessa is feeling some of the same sense because we have lots of conversations looking to the future, which can feel like a big unknown. I'm tearing up kind of, sorry. So my apologies about that. Yeah, anyway, so that was, thank you, Heather, and thanks, Vanessa. It was very a powerful dialogue that was just had. But I think the other, I think we touched a little bit on some of the more objective measures that potentially, like in traditional research, tends to be favored, right? Not that that's what should be favored, but just traditionally, right? Scientists like objective measurements, and we can do calculations and statistical analyses, and yay, and it's valid, maybe, right? So in terms of like GI symptomatology and things like that, or objective measures of physical health, some of those metrics tend to be kind of what comes with a lot of, say, exercise interventions for autistic individuals. But I also think we miss out in terms of thinking more longitudinally about sustainability too. A lot of research tends to be kind of very short, right? Focused trials. They're a one and done sort of a situation where it's like a trial of, say some sort of physical movement intervention or nature-based experience, right? But then after that research period is done, it's not that there's been a sustainably created program that's then been implemented and is available as a community-based resource. So I think actually trying to capture some of that, and that's a really abstract concept to try and hit at. But I think one thing that would be kind of cool to think through or imagine is like, how do we also think about like either feasibility? And what do I mean when I say feasibility, right? Like you could think of caregiver feasibility, like how easy was it for you to actually come and do this every week, right? Because I know there's therapist appointments, there's psychology appointments, there's just getting through the day stuff, right? And so is it actually like something that's feasible for people to kind of like try and fit into their lives on some sort of a regular basis, if that's the end goal, right? Or also on the child side, is this feasible? Is this fun? Like we don't have fun metrics when we talk about interventions, right? But like, why don't we have fun metrics what we're talking about? And people will have different definitions of fun, right? But which is fine, but enjoyment, right? Or some level of self-determined positive reaction to the experience as a whole, in terms of satisfaction. Because I think that's actually something we miss out a lot on. And when we think about behavior change in general, right? People are more likely to engage in things that they enjoy, whatever enjoyment is for them. And so we miss out if we try and focus too much on like the objectivity of the science or the intervention. I think we really fail in that sense then to actually create community-based spaces for autistic individuals and their family to really benefit.
Wonderful. This has been a very enlightening conversation, and it's certainly taken into consideration not only the diversity of autistic individuals, but the creativity that is necessary to address a lot of the challenges related to community-based lifestyle interventions. So before I turn it over to Priyanka, I wanted to give the panelists a minute to share any other thoughts that they have.
I think that too often we assume that atypical development is always problematic, but it isn't always problematic. Being autistic is just a different way of being normal. And so if we can just sort of figure out what is normal and then what is well-being for me individually as an autistic person, that's sort of got to be the goal and the focus.
Wonderful. Okay, so if no others, Dr. Fernandez, turn it over to you.
Thank you so much. This has been such an insightful conversation and has hopefully given our trainees and budding researchers a lot of food for thought. I heard so many great conversations, but I'll just highlight some things that stood out, which potentially researchers can think about and mull over a little more. One theme was the individualized concept or support, trying to cater your intervention to individual needs. Then I heard a lot about like approaching it more holistically in the sensory processing, exercise, nutrition. They are not necessarily independent of each other. They really interplay with each other. So how can we incorporate our intervention such that we are taking all these factors into consideration? And then briefly spoke about also the environments, like how can we make environments more inclusive for differing needs? I think those are all some great takeaways from this conversation. And I'm confident that this is one of many interdisciplinary and inclusive conversations that must occur for us to move the field along and find innovative solutions to improve the physical health of autistic individuals. Thank you to all the speakers for giving us their time today. And lastly, thank you to ARRB, LEND, and AUCD for making this discussion happen. Have a good day.